This episode of Let's Talk Natural Medicine is brought to you by BioGlan MedLab, proud platinum partners of ATMS. Built on 50 plus years of healthcare experience and nutritional science, BioGlan MedLab delivers practitioner-only formulas, trusted by practitioners, loved by families. Hello and welcome everyone back to Let's Talk Natural Medicine, our legend series. And I am joined by another legend today, Jennifer Webster. She is a naturopath, a herbalist with over 25 years of experience in natural medicine. She's internationally recognized for her work in integrative and supportive cancer care, combining evidence-informed practice with deep compassion, which is really important to the way she has helped shape clinical expertise and her life lived together as a package for those that she has served over her career. So I am delighted to chat with you. Welcome to the program, Jennifer.
Thank you.
Now, you have shared somewhere that you said you had a childhood instinct to eat weeds and had a fascination with plants. That's a pretty deep fascination. What do you remember about that early curiosity?
Okay, I remember probably I would have been 3, so
Wow.
around 3 that started. So eating, like I remember eating the waxy plants in the garden, and also I'm not sure if you're familiar with those weeds called plum puddings.
Oh, yes,
Yeah, I
I
know.
think,
Yeah,
yeah.
anyway, yeah, they've just got like a tiny little bulb down the bottom. And I used to reef those out and eat them. And there was also some other weeds, and I can't even think of the name of them. Um, Yeah. So, and my best friend who I've grown up with, so we're 6 months apart. She lived a couple of doors up. And I remember, like, probably from age 5, she would be telling me, don't eat the plants. You're going to get
Some could
sick.
be,
You're
her
going to get
mum's
a
probably
stomach ache.
saying
You're
some
going to
could
get
be
this. You're
poisonous.
going to get that. Yeah. Yeah. But,
You
like,
might die.
yeah, no, I never got sick. But I've got to say, too, like, my mum is really good with, we'll just say with plants, like just in general. So she would say, you know, okay, these ones taste nice. Why don't you try to eat these ones? Or, yeah,
Ah,
so she was sort of quite instrumental, probably in me going down that path, but also I think it was quite innate. Like I
hmm.
definitely just had that, we'll just say like the culture of the land. Like I just feel with the plants and yeah, yeah. So even like when we used to go bushwalking, because my parents were very active back in the
Yeah.
day, they'd take us into national park. So, along the way, she'd be saying, oh, here's some sarsaparilla, you can munch on that, or we'll throw some of that in a billy when we get down the beach, or,
Oh,
yeah,
wow.
you can eat some of the devil's thorns or the honeysuckle bushes, so along the way, sort of had
She
this.
really knew her stuff early and wanted to share that
She
with you.
did. She did. So, but mind you, my brother and sister didn't do it. It was just me that
Exactly.
did it, right? So, I mean, I've just had it in me, I'd say from a very young age. And with my mum as well. Like I used to get asthma as a child, so we're talking back in a day, probably before Ventolin. But look, I've got to say honestly, even when Ventolin came out, I was not allowed to take Ventolin.
Oh,
No,
okay.
no, because she didn't believe in any of that, right? She didn't
Ooh,
believe in
okay.
any drugs, no
She
drugs.
was right on the edge. Right.
Very much so. So she would take me to, it was actually one of my brother's friend's mother that lived like in a really old shack, So you'd walk into the kitchen. So we're talking like, 5 row days. It was really old. And the whole wall would just be full of, the 500 ml old herbal bottles there. So she was, I mean, obviously she must have studied somewhere, but yeah,
Hmm,
my mum used to take me up there and get me a
okay.
formula for the asthma. Didn't work as well as Ventolin, but
It was natural.
well, that's
Oh,
natural.
so
That's
you were the kid, I can just picture you in the garden now. You probably went on to then plant your own seeds and just have a
we had,
joy.
yeah, well, my mum's still alive. She's 96, right?
Oh,
Doesn't take
great.
any drugs, no drugs.
It's done
No,
well for
no,
her.
she's lived a life without drugs. So, but the place where I grew up, it's like a big double block of land. So back in the day, we had, the goat in the backyard, and we had like the chooks and the bantams and the ducks and, the rabbit and the dogs and a couple of cats and like the fish. And so we had everything. And then we had the three big vegetable gardens,
Yeah.
so we had like a platitude, we'll say, of different fruit trees. So the whole backyard, like it was like, you're basically eating off the land. And
Yeah.
yes, he had his own business, but he also, because we lived on the water, so he would also go fishing, like probably most weekends. So our diet was mainly like seafood and fresh produce.
Yeah.
Yeah,
How
yeah.
organically healthy. What a blessing. What a
Very,
childhood.
very organically blessed, like truly. I mean, our diet, if I compare our diet back then, like how we grew up,
Mm,
to, we'll just say modern day,
mm.
like like there's
Chalk
no
and check.
comparison. There's no comparison. No,
Mm.
it's just so fresh, and yeah, it was good.
So you
Wholesome.
felt the calling, and then you went, I'm going to actually
100%.
move into this profession, and you studied naturopathy and herbal medicine.
Yep.
Was that just like an automatic straight out of school? This is what I want to do.
Around the age 15, 16, I had all the books like Adele Davis, Let's Get Well, and
Ah, you were already
like
on the
Bernard
path.
Jensen. Yeah, yeah. And I was already sort of going down that path. When I left school, I actually worked in Sydney, like in the city, and would have been within the same block was Newton's Pharmacy.
Right.
Do you remember that, or you don't remember? I mean, the Newton's Pharmacy is still, they moved. So it's still there near the Queen Victoria building. I think it's in
Mhm.
York Street, but nothing like it used to be. So, you used to come out and walk down these stairs into, well, it's like a big shop, sort of kind of underground, half underground, but they just had like bags and bags of different herbs and, the dried herbs in a jar. So everything was herbs. And I walked in there and I was just like, I didn't know. Yeah. It was just amazing.
Like a kid in
It
a lolly
just
shop going,
sung,
oh,
sung to my soul. So I would be in that shop at least once a week. Like that was a huge
yeah.
thing. So yeah, sort of already going down that pathway. And then when I had my first son, I was 23. And back in the day when you're up all hours of the day and night breastfeeding, and you're watching the TV, Dorothy Hall used to be on there, and I think it was a Mike Walsh show, and they used to do like reruns, at 5 a.m. in the morning or whatever.
Oh, I didn't
And
know
I'm just
that.
like, oh my God, like I just loved her from the minute, from the minute I saw her. And I'm just, and right at that moment, I'm like, I'm going to study this and I'm going to study it with her. So we're talking like quite a long time ago. But then, life gets in the way, right? So I've got the son, and then we've got quite a big business, and then, went on to have twins after that,
Hmm.
and then, a fourth one. So I had like four boys, and yeah, I was just crazy. Like our life was just really busy. Anyway, the boys kept getting sick, as they do, right? When you got them all so close together.
Yeah.
And because we've got the history of, allergies, bronchitis, asthma, both sides
Yeah.
of the family, so you can imagine. Yep, so that was all
Probably a bit of
happening.
eczema in there as well.
Yeah, eczema, croup, Look, I sort of had it, we'll just say I mainly had it under control because like obviously going down a natural route, I'd done a whole lot already, but as far as one of them, his health, I'd taken him to a specialist, and his specialist was basically telling me that he had cystic fibrosis, which he did not
Wow.
at 3 years old. And I just said he has not, like, so I had a big argument with him and, went to see somebody else. So he'd had undiagnosed pneumonia, like even though he'd been seeing his specialist. So that was sort of a real turning point for me. I just thought, no, I need to do something about this. This is, allopathic medicine was not cutting it for me with the boys because I instinctively, as a mum, you know what's going on with your kids. So I took them to a herbalist who was a Dorothy Hall herbalist. Funny enough, I didn't know,
Funny enough.
like when I booked in anyway. So, and I was talking to her and she said, "You really need to be studying this." And I said, "I know." And I really wanted to study with Dorothy Hall, but I don't even know if she's still alive, like at that stage. And she said she is because I studied with her and gave me her details. And then, yeah, like basically I got straight in and that was that. Like I just absolutely loved every single second of being at her college and the way that she taught. She was tough, but I don't mind that. Like she's quite pragmatic. Yeah. So yeah, just loved it. And it made such a big difference. So the minute the kids had the herbs, basically, like their health just dramatically improved. So I just thought, well, there you go. So yeah. Yeah, I know. Amazing.
Amazing,
So that's
amazing.
basically how I got into it.
And then you started juggling all of that around a busy family life, definitely,
Yeah.
for young kids
Yeah.
and yeah, and all that comes with that. But yeah, it sounds like you've loved every minute of your career, but you've worked extensively with complex and chronic conditions, which
I
is really
have.
interesting because a
Yeah.
lot of people niche down and it's kind of like going, I looked that on your portfolio. I thought, wow, this is really interesting. So tell me more about that.
So, okay, so if we go back, we'll just say teenage years. I mean, I probably wasn't all that well, like from age, I don't know, maybe 15. And, again, I suppose like the system wasn't working for me, like I wasn't being listened to, told that, I should see a psychologist because there's something wrong with me. There's nothing wrong, blah, blah, blah. I
Mm.
should be on antidepressant, the usual rubbish. But anyway, so I ended up having like endometriosis.
Oh,
Yeah,
okay.
that's right. And then
Huge.
told at 17 that I better have kids, otherwise I'm not going to have any kids, so
Mhm.
that whole scenario. So I think just going through that personally, because I mean, as you know, like that's like a chronic disease state, which isn't actually real great. So there was that scenario, and then just even with the boys like that, going through years of that. Then the year that I graduated with Dorothy, my mum was diagnosed with breast cancer.
Mm.
Yeah, after being on HRT for like ridiculous amount of time. But anyway, so she had that, and then 2 years later, my father was diagnosed with an aggressive form of blood cancer.
Oh dear,
Yeah,
what a
yeah, I know.
huge
So
time for you.
anyway, so I mean, you have two opposing
Mm,
people here, right? So my father wanted to be a doctor when he was younger, so he was very much down allopathic medicine. So
mhm.
whatever the doctor said, you've got to do, right? Because
Yep.
he missed his calling because his parents couldn't afford the tuition, which is
Mhm.
fair enough back in the day. And mum completely at the other end of the scale. So it was interesting, I suppose just watching
Yeah.
how they navigated the system and just the system in general. Like,
Mm.
so I'd say like mum's very outspoken. So, she just put in a two bobs worth to start with, where dad was very much, no, no, I'm going to do this and this and this. And so that sort of probably really set the ball rolling. And then, in 2005, I went and did a master class, like in working with people with cancer. So that was like intensive,
Mm.
3 lots of 5 days. But that was, look, I've got to say that was sort of quite instrumental as well. So I think for me, like the mind body connection's got a lot to do, obviously, with everything because your head's connected to the body. So that was great. Like I just loved doing that masterclass. So that really sort of probably just set me up for, looking into that area further. So once I sort of did that, then I was getting calls from, the hospitals, like cancer groups there to go speak to, the people that are going through their programs, and then like the Encore breast cancer program. So to go do talks for them. I was already doing talks like, down at like some major gyms, like within the area that I live in, and, Rotary, Lions Club, some church
Yeah.
groups. Yeah. So a lot of, talking like around a trap. So just sort of, really sort of getting the word out there. So, I really do. I know a lot of people sort of say they don't want to work within that scope.
Mm.
But I actually, it might seem a bit weird, but I mean, really, I do.
It's your
I
thing.
actually, well, no, I really like it because, you know, I mean, not, and I'm not just talking cancer, like I'm talking people that might have had chronic fatigue for 25 years, you know,
Mm.
and they think that they've done everything. And, you know, within like a month to 6 weeks, like starting with you, like they've dramatically just changed. So
Which
the
is
people that
just
have crippled up with rheumatoid arthritis and, you know, from age 40 and haven't been able to move much yet, you can, you know, the dramatic change in these people. Like, I just think, you know, we're really blessed to like to be in a career that we can help people and it's so
mm,
rewarding. You know, I
mm,
think like even you know, the mental aspect side. So yeah, like I think, you know, I've just sort of kept evolving. Like after doing the masterclass, I went and studied kinesiology with
mm-hmm.
that. So again, that mind body connection. All right.
Yeah.
So, which obviously has got like a lot of different aspects to that. And then I became, you know, a faculty member. So I was actually teaching kinesiology as well and in a community, like other courses as well. And then I also took over like a yoga, Pilates, meditation studio.
Yeah.
So again, mind, body, you know, so because everyone these days is so stressed. Like I just think like, you know, stress, like really, you just think living in a big city or, you know, big mortgages, like I think
There's too much.
it's just, it is way too much. Like I think, yeah. And I think, you know, just, yeah, there's an element of, you know, what's true, what's not true. And yeah, just I think a lot of pressure on people to be a certain way, or they think they've got to be a certain way instead of just being themselves.
And I think it's overwhelming, even with all of that. It's if you then throw in a complex health condition, it's
Yeah,
overwhelming. You know,
yeah,
just being in a medical system is overwhelming. And so being
100%.
able to, like your dad and your mum, like what polar opposites. So being able to specialize in supporting people who can be so different, like people are so
They
different.
are so different. That's
So
right. But you've
it
got to
never ceases to
understand,
surprise you. But yeah.
yeah, but you've got to understand the person. And I think to me, that's, you know, you have to have that connection, like make that connection and really get that person sitting in
Mm,
front of you. Like what makes them tick, you know, listening to their story and, you know, acknowledging, like validating them and, you know, sort of working from it from that, you
mm.
know, aspect. Yeah.
And have
Yeah.
you found that when people are just exasperated, because that's it, they've tried everything, they're
Yeah.
waiting, they feel like, you know, well, why bother?
Mm.
Do you find the role of, you know, well, focusing on nutrition and herbal medicine that it really gives a sense of agency for the patients? Like there's something that they can proactively do? Is
Oh,
that
look, 100%. No, I'm all about educating the patient,
Mm,
100%. So, you know, yes, we can help them. And, you know, I think even through storytelling, like I think that's a really good way even to educate, right? Like
mm,
to change their narrative or their
mm,
perception of something, like just to kind of weave that in whilst you're, you know, doing, well, okay, this diet might be better for you, or, you know, we can do this, this, and this, like with the herbs and everything else to support the body. And yes, you do have some people that are like, oh no, you know, I'm not allowed to do this or that. And anyway, you work your way around that. But um, yeah, I do think, you know, we like as practitioners, we've got so much to offer. And as I say, you do get some people that they can be opposing, but then you're thinking, well, why are you here? like, like, well, you know, so and so told me to come, and I'm like, well, you know, like you're here, so,
into here, you
so
might as well,
let's work our way through it. You know, like how you were
exactly.
before was allowed you to get sick. Like you
Mm,
need to change something. You know, it's just giving them food for thoughts, like something to think about. So yeah, but I just think we can make such a big difference with our attitude, like how we treat people and not to overwhelm them, you know, not to be sitting there giving them 10 different things because they're
mm,
probably already on a, you know, huge amount of drugs. Yeah.
yeah.
Yeah. Yeah. Yeah. So it's giving them simple things that they can do that will make a huge difference.
Mm.
Yeah. Yeah.
So in 2006, you undertook an intensive postgraduate training
Yeah,
in integrative cancer
yeah,
care, which
yeah.
is amazing. And so that
Mm,
really did specialize you in that space.
it did.
What was that a Western model that you then had to sort of have your side too, or was it automatically very collaborative? How was that training and how did that affect you moving forward in that space?
Look, I think, as I said, the mind body, I've always been about mind body and thoughts. I love looking at people's personalities, different traits about them. So I think in that group, like even the practitioners, the other practitioners in that group were probably interesting as well. So that was probably, as much as a big learning curve as actually even the course itself. So we had, like Ruth Sewell, who used to be head of cancer education at Penny Broom Centre or Bristol Cancer Health. So she came over from the UK. So that was actually great. So you had her, input into it, like different stories she told, like just different way of treating people. Again, it's about, listening to the narrative and, working your way from there. So allowing people not to, well, just say, not to feel stuck in the
Mm.
system so that, allowing them to be able to move forward. Yep. Which
So,
is
oh, so important. So, how do natural therapies support people alongside conventional cancer treatment?
quite easily, really.
Mm.
So, well, I think quite easily. Um, okay. Well, I mean, look, first of all, I think you've got to, as I said, again, like figure out what's going on with the person and what they actually want from you. Because or some people mightn't have seen a naturopath or a nutritionist before. So it's working within the realms that they're happy to work with.
Mm.
But I think from a nutritional point of view and even a herbal medicine point of view, because I mean, at the end of the day, herbs are concentrated nutrition, right? So
Mm.
they're actually feeding the body. So, I just feel like, if you can do anything to improve that person's energy, like their state of mind, yeah,
Yeah.
you're already 80% there.
Mm.
Yeah, yeah. So I think it's, it's like, we'll just say like with some things, I think keep it simple, even though it isn't simple. But
Yeah.
because obviously you've got to look at all the drugs that they're on and see if there's any, contraindications, or, what sort of cancer they've got, how is it affecting their body? Have they had surgery? Like you've got to take all of that into account. Have they got family support at home? Or are they
Mm.
living with someone that's, really negative? Yeah, it's all of that. You have to take everything into account,
Mm.
and work with the person. Yeah,
Which is the value of the personalized care and the
100%.
evidence-based approach. You're
It is.
informing yourself for
Yeah.
this personalized sort of treatment plan
Hmm.
based on so much information. And that's why one, qualifications, but just the way you practice. You must have also had to sort of negotiate so many misconceptions that people have about, cancer care, integrative cancer care, natural therapies stand
Hmm.
alone in that space. Have you speak to that and also share, has that changed just dramatically as natural therapies has become a lot more mainstream?
It certainly has. I think, well, I suppose in my head, natural therapies have always been there. There's probably, it can be, we'll just say sometimes it can be difficult to navigate, like with the medical profession, because my experience, and I'll tell you about my experience with my son in a little while, but my experience is generally, just say with the oncologist, probably the more highly trained they are, they're more open to natural therapies.
Mm.
Okay, so, if you got, or, some of the young ones aren't too bad either, but if you got that middle group, they might be sort of more opposed, or some of the nursing staff are opposed. But I mean, really, there's so much evidence out there, and there's so much research that's been done. Like you can just kind of go, well, okay, here's the research on it. Like maybe, you want to be sort of having a look at that. But then also cancer treatments have changed dramatically.
Mm.
Like, I mean, chemo's been around for 75 years, I think it is now. Hasn't really changed that much, but there's a bit of change. But I mean, now when you're talking, um, like with immunotherapies, yeah. So yeah, I just think like that's actually a game changer in itself. So yeah, yeah, I think, trying to, and people that come in, so again, like you're going to have some people will come in and say, and I mean, they can have really aggressive cancers and say, well, I'm not doing anything. I just want to take herbs.
Mm.
I'm just, well, I mean, I'm a realist. Like, I'm not going to sit there and say, I mean, in some cases, that's just silly.
Yeah.
I just think, so my view is like, really, they need to do both. Like, if you want the best outcome, you need to be doing both things. Like, it needs to be integrative.
Mm.
So, yeah, so that's really where I sit with that, and even like with antibody therapies, all of that. So, yeah, integrative. And in
Integrative all the way.
my experience, integrative with the clients is the only way I'll go. So if they sit there and just say, I've got, stage 4 breast cancer, I'm just going to put some escharotic cream on it and that's all I'm doing. I'm thinking, well, I am not your person because I'm not doing it. Like
Yeah.
that's not going to give you the best outcome. So yeah, no.
It's the way it is.
Yeah.
Yep.
Yeah,
No.
that's it. Yeah.
Now, you referenced before, but supporting your own son through a rare and aggressive cancer
Mm,
must have been just absolutely huge. You're a mother and a practitioner.
yeah.
It just for that journey must have been so challenging, but it also must have profoundly shaped the work that you do
It
now.
was really awful because well, I mean, all the boys were sort of pretty healthy, but he was actually living in Chile
Mm.
at the time. So it wasn't like he was even here. So, we got a phone call. I'm down in the hospital in Santiago and they think I've got a tumor on my spine. And I'm like, what?
Wow.
What? Like,
What?
yeah. And then, he didn't tell us all the info until he sort of got back to Sydney. And he's like, I need to be on like a flight within a couple of days or otherwise they're going to operate and blah, blah, blah. So, we got him back here to RPA and they really didn't know what it was. So, they like obviously they did MRIs and everything else. So, blood tests and a full bit. Um, they said it could have been a type of sarcoma or lymphoma. They weren't really sure, but where it was in the spine was already compressing on the nerves. And if it grew much bigger, like it could have just ended up being like a paraplegic. So it
Mm.
had to be removed. But unfortunately, so we had like really the best neurosurgeon at RPA,
Mm.
but because they hadn't dealt with this before, they really didn't know what it was. When they took out the tumor, the sac actually broke.
Mm.
So that was just like, broke. Yeah, so you can imagine. So it just
Yeah.
sort of spread. Um, so when he got it out, he's like, look, I didn't quite get it all out. The sac broke, and I knew then that he was just going to be in for a world of trouble. This is even before they were saying, because originally they said, oh no, we think it's benign and rah, rah, rah. Um, so it, took ages to get the pathology back. Like it's
Mm.
over 6 weeks to get the pathology back.
Oh.
And within that time, he's started to get all the back pain back again.
Mm.
Yeah, so he had to go back in for another surgery. And with the second surgery, they said, oh, we don't like the look of this. Like, pretty sure this is malignant. And that just made it worse because I'm thinking, well, you just dropped all those damn cells through his body. So sort of went from that to, this very rare diagnosis that they were like, the surgeons just saying, well, look, we can just do another surgery and do this. And I'm pushing for an oncologist to look at him the whole time. Oh no, we don't need that. So, I had to really push, make the appointment myself. Finally got in, and his oncologist was then fuming because, then he had an argument with the surgeon. It was like this whole big nightmare.
Mm.
So, I mean, that was only the start of it because it actually ended up going everywhere. Like I'm talking everywhere, like multiple spots up his spine. It fractured one of his vertebrae in his spine. It went into his neck, fractured vertebrae in his neck, went into his shoulder, like chewed through his shoulder. So he had to have full shoulder replacement. Sort of this huge tumor came up at the back of his knee, into his quads. It looked like alien was growing under his skin, like overnight. I'm talking overnight. These huge tumors would just form. So multiple surgeries, on his quads, like to remove muscle, in his glutes. It was all through his pelvis. Like it was just beyond. Yeah. And that was, within, so he was diagnosed mid 2014. 2015 at the end of 2014, we'd already booked a holiday to go to Hawaii because we're supposed to be meeting him because he was living in Chile, right? So halfway point. And during that holiday, like I was sort of looking at him thinking, this is before we knew it was everywhere. And I'm looking at him thinking, yeah, I don't know. And then he's like, oh, my glutes are really sore. And, he had to come back to Sydney earlier, sent him in for a test. And it's like, oh, because, having problems like with reflux and everything, and then, so he's gone to see a liver specialist, and he's gone, you got a tumor in your pancreas. I know. So I think, oh my God. So then, there's that whole thing, right? You sort of think, oh no, not pancreatic. But I mean, it's the same type of cancer. So, had half of his pancreas removed, his spleen removed.
Wow.
So, I know. So then by halfway through 2015, after undergoing, multiple surgeries, like 9 surgeries in 11 months.
Oh, that's
chemotherapy, multiple rounds of radiation because of like his spine and where those tumors kept growing. Then they turned around and just said, "It's nothing else we can do for you." So it went from the original diagnosis of, like we don't think that this is, aggressive, like this cancer isn't known to be aggressive and blah, blah, blah. But what we found out was, which was interesting.
Extremely. Yeah.
Well, yeah, because it had gone metastatic, and whether that was, I still think probably because it was dropped. And I also think where they said the primary was in his spine, I don't think that was the primary. I actually think it was behind his knee. Yeah, so, but, gone from, this is non-aggressive to now there's nothing else we can do for you. Like, I think I was just...
That's just paralyzing.
Are you kidding? Like, I'm just like,
yeah.
Oh my God, like this is insane. Like, he was 25 by that stage. Looked terrible. I mean, I'd been taking him for all sorts of things, hyperbaric, hypothermia, you name it, we're doing it. Probably if I hadn't of, he wouldn't be here. So at that stage, I think, I just looked at my husband and I looked at Matt and I'm like, right, well, we just need to be doing something about this. So husband's good with medical research, so he's a researcher. So the 3 of us, and Matt's an engineer. So we just started hammering the computer, like looking for a clinic, any of the clinics. I mean, obviously there's multiple clinics worldwide, but, like you have to kind of look into it, right?
Yeah.
So, we looked like America and, Mexico, Japan, Thailand, Switzerland, Germany, UK. We sort of ran through the whole thing.
Looking for a trial somewhere.
Not so much a trial.
Yeah.
We knew that it had to be a clinic that's way ahead of its time. Yeah, that's, some really out of the box treatment. Like, I'm not just talking about your IVs, hypothermia, hyperbaric, because did all that here anyway, right? So I'd already exhausted all of that. But some new novel treatment that they could get their hands on, and that they could match his tumor type to a particular medicine, because we'd already sent over a sample of his tumor to one of the biggest like pathology clinics like in Boston on the advice of his oncologist. And they actually wrote back and said, we're really sorry, we can't give you any answers for this, $7,000 later. Yeah, good luck. And I'm
That's not
like,
going to help.
oh God, are you kidding? No. So anyway, so we found a clinic in Germany. And I just thought, no, this looks like the go. I mean, we'd rung up all these other ones, but they just didn't cut it. Like we're just like, yeah, no, that's not going to do. So I rang up, the doctor at this clinic. He was amazing, just said, look, like we can get access to like a whole range of drugs or a whole range of stage 1 trials. Like if those drugs match his cancer type, we can get access. I mean, obviously it all comes at a huge cost,
Mm.
but like when it's your child, what do you do? So yeah, so his oncologist was brilliant because I just said to him, all right, this is what we're doing. And he said, yep, I know that clinic. And he said, I'll do whatever you need me to do. So he got the lab slides from RPA, like the slides of his tumour, and packaged them all up for me, wrote a letter to the doctor. So like, he was sort of quite instrumental, wrote me the letter to get Matt on the plane because he was pretty sick. Like he looked like really, I was worried they weren't going to let him on. Anyway, so yeah, we got over there and that was just a game changer. Like that, the treatment over there, because he had this massive tumour behind his knee. I think I was over there with him for 5 weeks the first time. So that had virtually all but gone. So I know. So they were using like anti-GD2 treatment, which is a type of, we'll just say immunotherapy plus antibody therapy as well on him. And look, yes, it made him sick. It made him exhausted and aching all over. Like I think he felt like he was 200. However, the tumours were shrinking, right? So we're like, okay, this is good. Brought him back home, and then it's probably, I don't know, maybe 2 months later, my husband took him back for 3 weeks for more treatment. And then when he came back, like he was pretty good. So, I mean, that was, like he seemed much better. So it was like 2016, and he was talking about, maybe going back to work part-time and,
Amazing.
yeah, doing a bit of this, traveled overseas. So he wanted to have a holiday, went over to see his brother in Japan and, yeah, so he's doing all right. And then halfway through 2016, he started to get this cough. So, so they discovered a tumour on his lung. I know. The gift that keeps giving. And luckily enough, like I've been in contact with Rare Cancers Australia through, I don't know, for probably like the last 6 months. And they sort of suggested that I see, it's a professor anyway in Sydney because he sort of runs a Garvan Institute, like with St. Vincent's. Yeah, and now we're, running the most programs. So anyway, I said, okay, well, let's try to get in to see him. We couldn't actually get in to see him, but they, because they knew him, sort of got us an appointment. And when we walked in, it was actually, it's like, okay, so this is what's going on. Yep, sign here on the line. And I'm taking this straight to St. Vincent's and we'll get you on this trial, like immediately on a trial. Within the first dose of that immunotherapy, he stopped coughing. Like it just, again, another game changer. So, whilst he was on the immunotherapy, he had to have one more surgery because he'd already had other tumours come up. And really, he's been good. Like he still has to have regular checks. And yes, he's got, because, no, the last surgery he had to have a hip and femur replacement because the tumour had just about chewed through his femur. And they said if he breaks his femur, that'll be it. Like he probably won't survive. So we'd been on, we'll just say tenterhooks for probably having that information. It was probably the last year or 2 years. I can't even think now. Like, I mean, it might have been 18 months or something. So, we were probably a bit paranoid about him falling over. He still went overseas and did things, right?
You've got to live your life.
As they, well,
Yeah, it's
some gets to
important.
that point. That's it. So, so we're glad when he had that operation. And I think, like just having that diseased bone out of his system, his body has probably to the best that it will. I mean, obviously he's got the, he's like the bionic man.
Yeah.
So yeah, yeah. So, he's got some limitations, but he's got an amazing attitude. Like he doesn't let things hold him back. He was told because he'd had radiation and they stuffed up one of the sessions of radiation and didn't cover him properly, that he would probably never have kids.
Hmm.
So yeah, no, so he's got a little boy, like he's got a partner, a little
Oh,
boy. Yeah, like
it's a miracle story.
he's
Yeah.
amazing. Yeah, but he's got the right attitude. But with
Mm,
him, again, like I mean, he's me. He's a male version of me. So I get him 100%. So
mm,
the whole way through with him, I would say, okay, let's plan a holiday. Let's
mm.
plan to go here. Let's plan to go there. Like maybe when you're a bit better, let's plan this. So it was always having that carrot there.
Got
So
to have
he
something
had
to look
something,
forward to.
he
Yeah.
has to have something to look forward to. It's not about doom and gloom. Like no one wants to be, the whole doom and gloom because I think then you feel like just that's it. Yeah, yeah,
Exactly,
yeah,
exactly.
yeah,
You got to
yeah,
have some fun times amongst the
yeah.
challenges
Yeah.
for
So,
sure.
so, so like
So,
during all of that, like the many years of all of that, his oncologist was amazing. Like I mean, he was older, but I
mm,
know when they first diagnosed Matt, I had this list with me, and I just put it in front of him, and I said, "This is what I do, and this is what he's doing, and
mm.
you can tell us what you're doing." I said, "Have you got any objections to that?" He said, "No." He said, "No, you just go ahead and do what you're going to do." And I said, "Good." Yeah. Yeah.
Well, I can see why you have mastered the art of, yeah, complex
Mm,
cancers, health needs, but also
yeah.
with a journey like that. Oh my
Mm,
goodness. I know the listeners are like, oh my goodness, I'm so glad he's
mm,
okay. It's a journey, and we know some don't make it, but I think it's about
mm,
by the way you've approached it together,
mm.
it takes a village and it also there's healing through that journey, whatever the outcome.
100%. Well,
And
100%. I mean, you're not going to come out the other side the same person.
no,
I mean,
it's
you might be,
huge.
mainly you might be, but it definitely changes people's outlooks.
And it must have changed yours as a practitioner too, even after
Mm,
all the trainings and all the experiences, when you've
mm.
had such a personal experience, it must have just sort of molded you into a unique position that you can really sit in that space with those.
It has, but I'm going to say, like when it's one of your kids,
Oh,
like or
nothing
grandkids or whatever.
compared,
No,
nothing can compare to that.
well, it's interesting. Like I think when he was first diagnosed, one of my close friends just said, "Well, now you know what it's all for. All this training that you've done, everything that you've done coming home to
It's all
roost,
for me.
and this is your calling. That's it."
Oh. Now, just to finish up, you wrote a
Yeah,
book as well. You're a
I
woman who
did.
just does it all. Don't be bitter, be better. I love
Yeah,
that.
yeah, don't be bitter, be better. That's it. Well, the
And
reason why I called it that is because, hours spent in hospital playing cards with we'll just say a card sharp, like, he can count the cards like so he's very competitive and so am I. So it was always, game on when we were playing cards. And if I lost, not that I ever chucked one, but he'd just be like, don't be bitter, be better. So that's why the book's got that name.
I love that. Oh my goodness. Jennifer, I cannot believe your journey. Our hearts have broken throughout that story, but I just love you
Thank
are a
you.
can-do kind of woman
Yeah.
who has just approached life in, well, what can I do? What can I give? And how can I, be there for others and also
Mm,
help their journey be the best that it can be. And so, yeah, I
thank
really
you.
want to honor the service that you have provided to the
Thank you.
profession, and thank you for sharing that with us today.
Thank you.
And to our listeners, oh my gosh, right? Yeah, life is challenging. Life is challenging. And this has been a great example of, integrative care, realizing that people can come from all different approaches, and it's ultimately what's the best for that person. And
100%.
For our listeners, if you haven't yet joined our Friends community, it's a community of all Australians who just are interested in natural medicine. So if you're watching this on a video, you can scan my QR code. It'll take you straight to atms.com.au. And those of you who are not scanning, you can click on Friends. That's atms.com.au. Click on Friends and you can join our community. It's free. How good is that? And you will receive an email in your inbox every 2 weeks, no more than that. You'll also get links to podcasts such as this one. You'll be given blogs written by some of our accredited natural medicine practitioners. You'll also get recipes from celebrity chefs. We're all about just educating you and supporting you on your journey. So come and join us in our community of friends. And once again, thank you to Jennifer for sharing her story with us today. And I look forward to sharing with you another legend story in our next episode. So till then, stay naturally well.